want to start by thanking the ComPASS NIH project for inviting us to this innovation panel. And I hope what we have to share is useful for all the CHESIs. So greetings from Puerto Rico. Um, this is the motto of our project, the science of a better life for all. And we wanted to start by sharing with you what is the focus of our project, our structural change that we chose to tackle for the Puerto Rico side. It's focused on child poverty as the main obstacle for health disparities for young people in Puerto Rico. Overall, 45% of the Puerto Rican population lives under poverty. However, when we look at youth and children, 57% of young people and children live under poverty. And when we look even further into specific geographic areas, the southwestern region of our country is very much impacted in a particular way. The reason why we chose to focus our 10-year ComPASS initiative in this geographic area, in some of these towns or municipalities, as we call them in Puerto Rico, up to 80% of the children might be living under poverty. So that will be our main interest and target of focus. Particularly, we want to work on reducing child poverty, increase mobility opportunities, promote equity, well-being, and healthy development, and integration of services. In many of these areas, they have been heavily impacted by the earthquakes, hurricanes, as well as the bankruptcy that Puerto Rico experienced in the last decade. So this is why we're very much interested. Mobility is important, but mental health is pivotal for young people, families, and children to be able to harness opportunities. If they are emotionally deregulated and affected by anxiety, depression, and trauma, that might hinder their capacity to take advantage of mobility opportunities. And this is one of the reasons our project encompasses a collaboration with groups that work on that policy side of poverty, and also groups like Grupo Nexos, who focuses more on the mental health side. So we are hoping through our project to interconnect services, promote positive development, work not only with the children and the families, but also the ecosystem that takes care of them, and do all of that from a trauma-informed approach. In general, we know this is really important with any kind of preventative or remediative service, but it is particularly important in areas like Puerto Rico, and I'm going to get into that in a moment. So when we think of that threshold of change, when one works with communities like Puerto Rico that has been historically colonized, first by the Spaniards, later by the United States, historical trauma, it's an important thing to take into account. So when we think of poverty, we have to think of it in a multidimensional way, as I mentioned before. And we have to think of the intersectionalities that people experience in their lives, reason why, as I mentioned before, there are nuances about this southwestern region that are particular and are important to take into account as we design this structural intervention. And certainly we cannot do this alone. It really takes a village. And that's why our project chose to look at this from the lens of collective impact and really bring together a diversity of knowledge and experiences to try to move the needle in the next 10 years, looking at individual level factors, social connections, conditions of living, and finally to the higher structural level thing, all in the hopes to really bring about equitable, fair, and sustainable interventions for children and families. Our project is very much aligned with the Sustainable Development Goals. We particularly work with 5 of those goals, as you can see in this slide. So what are the innovations that we have brought about? We knew, being a group that is specialized in mental health, that we we needed our HERA to be much more expansive. As you can see here, we have been able, as an honest broker, to bring together government groups, nonprofit groups, third sector groups that with technical knowledge, third sector groups with service knowledge, as well as private foundations, government entities. So the way we went about bringing our HERA together was really to spend time during this first year to bring all of those groups to the table. We really work, as I mentioned, I think one of our innovations is to really work from that collective impact standpoint and to take the time during the HERA meetings to allow for exercises where HERA members could really reflect upon what is this project about, but also what is in there for me as an organization, and if there is a match in vision of how collectively we work together, and giving people permission to decide whether they wanted to be a core member or a more peripheral member. And so we spent a lot of time in these first two phases of the collective impact model. Part of what we did in the process was really to talk to the group in an inspirational way about what could be possible. So we did this visual analysis of where was the policy framework in Puerto Rico at the moment, and it's really very much in a threshold of potential change. And without going into all the details now, our legal framework has gone through major important changes in favor of children and families, from early childhood all the way with to youth who are involved with the juvenile justice system. So we look at that. Then we look at case studies of good practices in our jurisdiction that could be models to emulate and to take further. And then we imagine with the HERA, what would happen if from conception all the way to adulthood, children and families would have a continuum of care that will provide them mental health focused interventions, whether or not they were at high risk, to have a better life. And that's the idea behind ComPASS Puerto Rico. After doing that visioning with them, then we engage into a dialogue with them, an honest dialogue, to see whether or not they wanted to participate and how they wanted to participate. Part of what we did as an innovation was also to keep people very informed through chats, through WhatsApp, and newsletters that inform them of what happened from meeting to meeting. In one of our meetings, I'm just going to highlight some of those reflective exercises we did. We did a collaboration spectrum exercise where people had the opportunity to, after looking at our desired outcome, reflect upon where is my agency position within the continuum. Am I an agency or organization who really believes in integration and collaboration, or am I more an organization who drives from competition, and whether or not this project was a good match for them to participate? And so they did the exercise in two levels: their current state of their organization in terms of the continuum versus their ideal state. And again, part of doing these exercises was giving people permission to really say who they are organizationally, or whether or not this project was a good match for them. In a different meeting, then we moved to do the trio problems and really went deep into the mental health conditions in Puerto Rico, what they thought was possible and important to achieve for youth and families, and really have that conversation so that they could see if there were synergy in the group or if they were looking at it from different standpoints. So as part of this exercise, you can see some of the products of the different participants, and this was really helpful in relation to that initial image that I show you about how we were coming about it from Grupo Nexos and the core group of the project. We also went down to the geographic area and had listening sessions with organizations to really understand their perspective in terms of how the phenomenon of mental health and poverty and youth and trauma happened. and really for the HERA to then use that information to continue the reflective process. That took us about 3 meetings. And the reason of doing that was really to have the HERA reflect upon it before they made a decision in terms of their level of involvement they wanted to have in this project. So as you can see in this image, I think it was by the 3rd meeting, we had an opportunity for them to then decide whether they wanted to be central or core to the project, involved, supportive, or interested. This is a great exercise. We have used it before in other initiatives, and I love this from the collective impact model because really it provides people an opportunity and a non-judgmental space to decide what level of involvement they really want to have. When we did this exercise, about 30 of the organizations out of the 75 decided they wanted to be core members. Today, about 33 of them have decided to 3 more joining on the process. And the rest of the organizations are going to be involved, supportive, or interested. So that gives us an opportunity, like I mentioned, to have a big village for the different initiatives that ComPASS Puerto Rico is gonna put forth. In terms of strengthening the foundation for a project that is, supposed to last 10 years, that's a long time for commitment. Part of what we have done for our needs assessment is to really anchor it in the center from a collective impact perspective. And I think that's pretty unique. Typically when we look at needs assessment, perhaps the focus is on the profile of social determinants of health or the epidemiology, which is the yellow circle. For us, we went further than that. And I think that's an interesting innovation because we really understand that that is necessary, but it's not sufficient to achieve success with this initiative. So we really had to expand the needs assessment to include policy analysis and mapping, as well as from the get-go, a sustainability piece of the needs assessment that is very much focused on available resources, funding, and in the long term. So I think that's an innovation of our needs assessment process. We also, another innovation that we have brought forth in Puerto Rico is that from the get-go in our application, we imagine and dream of having a curated data hub. Our jurisdiction is pretty unique in the sense that because we're a territorial jurisdiction, we're not necessarily included in all the national surveys that other jurisdictions are included in. Therefore, we knew we had to think about creative ways to surpass that challenge. And part of it is that we have made another parallel group to the HERA. We're calling the curators table. And in the curators table, we have brought to the table about 10 groups in Puerto Rico who are data managers. And we are in the process of establishing a mission and a vision for the group. And the idea is that this table of curators is going to help the HERA in the long term, and that this is something that we can sustain. And you can see some examples here of the things that we want to do with the curators table, including sharing data, collecting and normalizing population level data, having repositories where we can use the same sources of reliable data to curate in different ways, and also collaborate with other groups in the US. And finally, like I mentioned, the leveraging of funds issue is a great innovation. We have a leveraging analyst in our project from day one, and we have been very intentional about looking for sources of funding that could be leveraged together with the NIH support so that this can be sustained in our jurisdiction even beyond the 10 years of the ComPASS project. To finish my presentation, I want to show you an example of how we've been able to do this before a smaller scale and the benefit that we have seen it brings for our jurisdiction. Just to give an example, in early childhood, about 12 years ago, we started working with the Affordable Care Act monies for home visiting programs. as a technical group helping the state. And as you can see, this program has grown across the years. What happens when you leverage intentionally resources of this sort is that you can bring way more services with intention. So many years later, in 2019, an opportunity for community funding for home visiting came available. And what we did is we leveraged together with the state group to intentionally submit this application and expand the areas of services. They're distinctive services, but we're working together and in collaboration to ensure the population gets continuity. So you can see how this program grew. It was a great success for 5 years. And now in 2024, we added another grant of that funding stream to expand the funding. And you can see how more geographic areas are covered. This is something that needs to be done in an intentional way. And that's part of the message of why we included the leveraging in the needs assessment. It's not only about submitting for proposals and getting it, but it really requires conversations as honest brokers with partners from a collective impact standpoint. This investment now represents $50 million that are being put towards these communities that you see highlighted, with a particular objective of providing early childhood home visiting programs. Our dream with ComPASS is that we could replicate this kind of effort with other age groups in the continuum of our projects, which goes from 0 to 21. Yeah. So if you are interested in knowing more about our health equity research assembly meetings, you can join us through this QR code. We're about to open our website as well during the month of October 2024. So we're hoping that this will continue to be a very inclusive project with the collaboration of many organizations. I thank you very much for your time, and there's my email and my phone number. Please feel free to contact us if you want further information. Thank you.